Welcome to the Wiggly Sausage Farm. Today, we will be discussing Cache Valley virus. This virus is a zoonotic disease that affects humans, sheep, goats, deer, and cattle. Seeing that this virus affects goats and sheep, I believe that it should be discussed for new and more experienced goat and sheep owners to be aware of. This is not an all-inclusive video, but more of a highlight video for awareness. Reference used in this video will be available in the description box below. Let's get started. The Cache Valley virus was first isolated from the mosquitoes collected in Utah's Cache Valley. This disease can cause abortions, birth defects, and stillbirths in pregnant goats and sheep. For adult pregnant does or ewes, this disease causes a slight feverish response with generally no clinical symptoms. Therefore, there is to date no way of detecting infection of this disease until after the effects have already happened. Earliest detection happens if a suspected doe or ewe begins to have vaginal bleeding and is suspect of having an abortion. If this happens, it is possible that the pregnant doe or ewe was infected with the disease. The next possible time for detection is during kidding or lambing. If a doe or ewe has kids or lambs with birth defects, or gives birth to stillborns, or has other issues, Cache Valley fever virus may have been the cause. The virus seems to affect the central nervous system and the musculoskeletal system. In some human cases, aseptic meningitis is linked to Cache Valley fever virus reported cases. For both humans and livestock, infection occurs when the animal is bitten by a mosquito carrying the disease. Mosquitoes become infected when they bite an infected animal, and thus the cycle continues. To date, there are many types of mosquitoes that carry the virus, but it is not known which species is responsible for spreading the disease to humans, goats, and sheep. For humans, very few cases have been reported, but symptoms include infection of the brain and the spinal cord. As of now, the CDC recommends for prevention efforts, similar to preventing tick bites, since there are no preventatives or treatment at this time. This includes wearing insect repellent, long sleeves, and long pants to prevent bites. Humans are also considered to be dead-end hosts. For livestock, the same preventatives are recommended, but trickier. Insecticides can be used in barn and pen areas to keep mosquito counts lower. Perhaps spray on repellent products safe for goats and sheep. However, preventing mosquito bites on goats and sheep is not a perfect, unflawed prevention system. And with no vaccines or treatments, this is a disease that is economically and emotionally devastating come kidding and lambing season. As mentioned earlier, the virus is only potentially detected if abortion occurs and the doe and ewe comes back into heat, or if the doe or ewe gives birth to stillborn kids or lambs, or births kids and lambs with birth defects. Bred does and ewes that are infected on day 32 and earlier in their pregnancy are at risk for their fetuses being aborted. Bred does and ewes that are infected on days 32 through 37 in their pregnancy are at risk for their fetuses having musculoskeletal and central nervous system lesions. And bred does and ewes that are infected on day 38 and later in their pregnancy are likely to have their fetuses clear the infection and have no congenital defects. To test for the disease, the stillbirth kid or lamb must be sent into an animal health diagnostic lab For example, Cornell's Animal Health Diagnostic Center. If any signs of abortion, with symptoms of vaginal bleeding and returning to heat cycles in suspected pregnant does or ewes occur, I recommend that you put Cache Valley fever virus on your list of suspected diseases. In addition, if a doe or ewe births stillborn kids or mummified young or young with birth defects, I also recommend that you put Cache Valley virus on your list of suspected diseases. Why is this important to discuss? This disease does not have any detection tools to help prevention for goat and sheep owners. I think it is important to bring awareness to this disease, especially as new or even experienced owners may not conclude that this disease was the root of their unfortunate birthing season. There are so many other diseases that cause similar symptoms, such as stillbirths and abortions in goats and sheep, and it is worth enlisting this disease to that list to identify the cause of the reproductive issues within one's herd. Infection is, unfortunately, as simple as a mosquito bite at the right time of gestation. I hope that more awareness and more research becomes available to provide owners with more tools and information to assist us in our kidding and lambing seasons and for our own health. As always, thank you for listening and good luck on your farm.